From your observations, have you noticed any differences on impacts on Indigenous parents and children during different points of the pandemic?
The pandemic has been extremely hard on our families and children in so many ways. Yeah, just the whole like isolation and lockdowns and all that, those kinds of attributes of the pandemic, school closures, daycare closures, all the extracurricular activities for external activities for kids, those closures. This has been really hard on our families, even more so on our families that the ones that are highly vulnerable and struggle, with poverty and that live within, difficult socioeconomic conditions, and to throw the pandemic outcomes on that, just like further escalates already an already trying situation. And so isolation's been hard on our families, and because of the lockdowns. So we saw eventually the outcomes happen. If the police are involved, we saw an increase in domestic violence. I saw more afterward, like the first little while when everyone's in lockdown, like we didn't see at that time an increase in crises, that precipitated some kind of intervention that would happen. But eventually, as time moved on throughout the pandemic, I think the stress just gets too much on families, and then eventually we've seen in the last year, particularly a little jump in interventions and apprehension, and those were due to mainly substance abuse and family violence. So it's taken a toll, even more, the pandemic, on our families. It's been hard. And what's sad is that really I find that with this pandemic, our child welfare sector, the workers and the families and children that are involved with child and family services are sort of like we were forgotten. I never heard here in Manitoba, maybe in Ontario it's different, I don't know, but you would never hear public service announcements about, say, for example, our workers. We're essential service, right? We never shut down. I have not worked from home. I've been here since day one. Me and my senior management team, we've all been here, and we had to put staff in rotation eventually, so we mitigate the spread of any COVID in our workforce. So we'd have workers who could go out and provide the essential service of child protection work, right? But you never heard like the government, announce or provide any accolade to our frontline workers who are still fielding calls throughout pandemic. Pre-vaccination, particularly in the pre-vaccination phase, right? So we're going in the homes with police officers and first responders and all that stuff, so we can exercise the provisions of the Child Family Services Act. And that's 24/7. We're not a 24/7 designated intake. We have an office that does that here, like in Winnipeg. It's called Anchor, All Nations Coordination. But yeah, it's 24/7. And so, but I just felt bad for our workers. You never, the government leaders never mentioned those workers. You'd always hear accolades, and rightfully so, of course, to our healthcare workers and our first responders and personal care homes and our stores and every, but you never heard about our workforce. And you never really, the minister never talked about, our vulnerable Indigenous children and families that are already in such challenging, difficult situations, having to endure through this pandemic. And my hats are off to our families and children that did endure through this and maintained strength and stability throughout this time. Because it could have been a lot worse and it wasn't. So, all hands are on deck and we all work together. We were there for our families 24/7 for sure.
Yeah, those are all really important points that Trudy has pointed out. I'm actually involved in another research project, Amy, where I'm interviewing people who have been sexually exploited. So right now I'm interviewing adults with lived experience. So most of them are Indigenous women who obviously with the pandemic, they'll moonlight and, on the side to try to make money. But I've met many women who have been in transition from a First Nation community, moved here to Winnipeg just prior to COVID. And then, of course, they're living in poverty, their children are apprehended, and there have been situations where they don't get to see their children because in some cases, this is a vulnerable person, they've become homeless, right? We don't know if they have had their COVID shots, and that meant that then, that's kept them from seeing their children because they haven't been able to prove that they, have had their shots. And it's designed as a way to, keep both parties protected, but at the same time, it has, created this abyss between that parent and their child. And, with both parties, I think both children and parents not quite understanding. And on top of it, they're new to the city and they're living homeless now. And it almost seems like there is a level of services that has just sort of disappeared for, homeless parents. I don't think we know enough about their situation as well. I think we need to learn more about how that came to be and how, the way that it looks, given the pandemic and how it's impacted, them and their children.
From day one, I think we instituted our first pandemic policy on March 17th, 2020. I had to pull, since the pandemic, this is like putting all the hard copies in it. This is our pandemic thing, right? This is directive after directive and changes in health orders and all in changes to service provision and that. Family visits, particularly in some priority areas, were priority. The consideration was never if the parent didn't get vaccinated. The bond was that connection had to remain intact during this time, no matter what. And so those children would, we have the space here at the agency or home visit, depending, where the visit would take place with all the PPE is available, and that we ask the questions. If we have the visit here and the parent says, yes, I have COVID, well, I'm not going to let them in the building, right? We'd have to postpone the visit for, how many recommended days the science indicated at that time for the virus. But yeah, that was for us anyways, and that was entrenched in our policies, was those family visits. But they did diminish. This was very hard on children, but we were able to obviously provide virtual visits, and we provided the means so families could have those, like what we're doing right now on Zoom. Also, we never, because we're only provincially funded, the province of Manitoba did not and had never provided any exceptional circumstance funding for us to pay the extraordinary costs to manage an agency under a pandemic. Well, Marlon, all the laptops, the machines, all that stuff, we absorbed that cost within our blocked funding to, we absorbed all the pandemic costs here at Nimikie.
Right, but you also have applied to other organizations to help offset the costs that, associated with the pandemic. So Trudy has been very, she's looked for those resources to try to help hold us, the agency accountable in some ways to those children and
Oh, yeah.
families.
To
help
get that
maintain
little
those
assistance.
connections. Yeah.
Yeah, no, but the province, our funder and our the minister who's responsible for children, we never received any additional funds from the province. So yeah, Marlon's right. We were able to get a little grant here and there to help with the costs associated, for example, like with our youth and educational costs, right? Through the Children's Foundation of Canada, I believe. So that was able to help us. So yes, so the pandemic has been extremely hard on children, Indigenous children and families involved in child and family services. And yeah, I mean, things were shut, you know, we had to, the programming though, we were able to continue virtually, but then, you know, the mental health needs on our young people was so, I think eventually it just got to them, you know, and it just was so long. And when you're already dealing with trauma, intergenerational trauma, this just it really compounded on an already fragile state, so to speak, right?